I arrived in Kazakhstan about 6 months before the pandemic started, and I was actually very lucky to have that time to build some relationships. So I had a few months here on the ground, and then at the end of December of 2019, I started watching the reports coming from China. Kazakhstan has a huge border with China. There's a lot of cross-border trade, and the part of China that was affected near Wuhan is not very far from Kazakhstan.
This was a virus that actually affected every country in the world. And I think this has been a challenge for us here in Kazakhstan too. And what have we done? Well, we've done a bunch of things. CDC itself donated about $1.3 million in assistance. Then that was supplemented with over $5 million from assistance from other parts of the U.S. government. And what did CDC purchase? CDC purchased the majority of its funds, about $900,000, was spent on laboratory equipment.
Да, оборудование, которое мы поставили в лаборатории Казахстана, позволяет увеличить пропускную способность лаборатории. Ну, то есть, условно говоря, если лаборатория может тестировать в день 200 образцов, то с помощью высокопродуктивного ПЦР-оборудования, с помощью автоматических станций, этот показатель может подняться до 1000 образцов в день.
Да, конечно, это оборудование, оно будет практически использовано для всех любых других инфекционных агентов, которые имеют не менее значимость, чем SARS-CoV-2 для общественного здравоохранения.
In fact, to this day, most of our global health work is focused on infectious diseases because we know that these diseases don't follow national borders, and by investing in other countries and helping them grow their own health systems, we're able to assist them in controlling a disease when it occurs in their country and preventing it from spreading to other parts of the world.